Okay, here's another neuroprotective tool. I want to talk about what happens as women get into midlife and that estrogen drops. This comes from the work of Dr. Rhonda Voskul in UCLA. And look at this. Let me explain to you what's happening on this page. So red is estrogen, blue is testosterone, right? And here's the age across the lifespan. So during puberty, you get a rise in testosterone and estrogen. And you can see how this testosterone goes up and stays up. And for men, it's around age 30 when it starts to decline. Okay. For women, we keep up our estrogen much longer. And as at around age 50, average age is 51, there's a steep decline in estrogen. And this is why a lot of women will experience brain fog, fatigue, they don't feel like themselves, mood changes, past traumas may resurface. And this is a time where a lot of neurodegeneration can happen. Disability can start progressing. Remember, I said early on, as we age with MS, we can go from sort of a relapse dominant picture to a more degenerative picture. And so for women, this happens when there's a steep decline in estrogen. For men, it's much more gradual, but this may explain why men tend to experience sort of a heavier burden of MS symptoms earlier on. So what do we do about this? So we know sex hormones are neuroprotective. There is data that for the right patient who is a candidate for hormone replacement therapy, it can be started early in menopause, not when you're 5-10 years past menopause, but pretty early on. The earlier you do it, the more brain you'll preserve. And there's some data that it may actually promote remyelination. So estrogen replacement can promote what's happening to your myelin. So this study used estriol. There's more than one kind of estrogen. There's estrone, estradiol, estriol, and this is estriol. What they saw was a reduction in relapse rates, cognitive function improved, and at 12 months, there was less atrophy in the group that used estriol. Okay. Estradiol or Premarin is a problem because of the receptors it binds in breast and uterine tissue. You can't push the dose up. And so estriol has turned out to be a better alternative. You can talk to your neurologist about this, talk to your primary doctors, gynecologists, and see if you're a candidate for this. Now, I wouldn't forget our male friends here. As I said, I think it is important to check your testosterone system. Oftentimes, if I have a young man with an autoimmune disease, I will check his total testosterone. If it's under 300, I will get curious and check some other markers like free testosterone, SHBG, which is sex hormone binding globulin, DHEA, because I want to understand what's happening in the testosterone system and if this person would benefit from replacement. Right. So again, this would require someone who understands hormones for them to do this workup for you. But I think it's important. It's another upstream tool to help us figure out how can we protect the brain better.